Imagine you're about to walk across the street. You press the walk button, and that initiates you to walk. It's your right of way, and so you proceed across the street. Out of nowhere, you're hit by a car. This car, the driver was paying more attention on the phone rather than his surroundings, obviously. You're taken by ambulance, and you seek immediate care. While you're in critical condition, you're more worried about the fact that you have all these medical expenses rather than the bodily damage you're in because you don't have health insurance. I'm here to tell you today why health insurance is so important. So what exactly is health insurance? Health insurance is kind of like your security blanket. So when bad things happen to you, such as like a car accident or an illness or anything like that, then that health insurance can cover you financially. It provides monetary compensation due to certain medical expenses and accidents. It also protects you insuredly against other losses or kind of suits as well. The benefits of having health insurance, it's, like I said, it's basically a security blanket. So it gives you security along with reassurance that you are covered. So if you were sued and it wasn't really your fault in the car accident and you both got hurt, then that helps you financially in that standpoint. Or else if you got cancer or anything like that, that also helps too. Some of the consequences of having health insurance are the high premiums. So depending on the kind of company, insurance is expensive regardless. And if you're a low-income family, that can kind of be difficult for you, but you just kind of have to manage your finances and make sure that you keep paying so you're covered all the time. You could possibly become bankrupt from it due to certain occurrences of using claims and such things like that. You can also become uninsurable in certain cases if you were to use it too much and not to in a negative way. Another kind of consequence is also some of the contracts, because the contracts are very lengthy and very hard to understand, so make sure you do your research and talk to your rep face-to-face about it. There's like different kinds of health insurance. There's employer, there's personal, and there's also government. Government is, like, for example, Obamacare, so that pretty much is more towards the low-income families that need help. Now today, they're actually having an act saying that people are mandatorily supposed to have health insurance. Some people think that's kind of wrong, but other people think it's necessary because, yes, anything can happen. Employer, an example of this one, my mother actually uses this one through school. It's Blue Cross Blue Shield, and so she has many benefits such as also like health, dental, and optical. So, and then another kind of is on a personal level, so such as Humana or something else. Certain terms you need to know when you're getting health insurance, co-pays. Co-pays are a specific amount when you pay when your certain services are rendered. So, like, let's say you need to go to the doctor and you keep on needing to go and get checkups. So you have to pay this copay so that the insurance can cover it, which isn't very much. Like, let's say you need to go to the doctor for a physical, so it would be about $30. Co-insurance is when you, like, only certain insurances have co-insurance. It's a payment that you have to pay along with your deductible. So let's say there's an insurance that covers only 80% of it. That other 20% you have to pay yourself along with your deductible. And deductible is a portion that you cover once a year or within your monthly term or whatever your policy pretty much has. And then you're covered after that time and time again. Another term is premium, so that's your monthly payment along with to keep your policy going. And catastrophic coverage is when it pays for your healthcare expenses above a certain deductible. So, like, let's say Hurricane Katrina or tornado or anything like that, then you are covered. A fun fact, according to medical news today, Americans with long-term or serious illness are at least able to pay for their medical bills and expenses expenses among the leading developed nations in the world. So we're kind of at a standpoint that it's hard for us to get health insurance because of our low income status, while otherwise other people are able to pay for it as well. And here are my sources. Thank you for hearing my speech. After I've told you about health insurance, who all here in this room thinks it's necessary to have it? Please raise your hand. Alrighty, there you go.